the station that's on your side. This is Channel 7 News Daybreak.
November is Diabetes Awareness Month. An estimated 30 million people in the United States have diabetes. Of those, it's estimated that about 7 million are undiagnosed. And oftentimes, diabetes can be prevented. So to help you stay healthy, we've got Baptist Health Dr. Devon Ballard in studio of Sherwood Family Medical Center. And we're giving you some advice this morning on the different types and maybe how to avoid it in your life. Dr. Ballard, thanks for being here. Let's start with the basics first about diabetes. What do people need to know?
There's really two types.
Okay.
You hear about type 2 and type 1. Type 2 is more common. Type 1 is the insulin-dependent diabetic. Usually you hear about the 8 to 10-year-old, 12-year-old kid that gets sick, and they usually will diagnose them. They don't have any insulin.
Oh, okay.
Their body doesn't produce any insulin, so you have to give them insulin. There's no oral medicine that will help them.
Really?
Type 2 is what we usually see the most in our office, which is the middle-aged, usually adult, can be actually younger kids because obesity is a big problem in the state of Arkansas. And so you start seeing now 18-year-old, 21-year-old diabetics because they weigh 250 pounds at 13 years old. Wow. And they just get bigger, and as the more you weigh, the more chances are that you will get diabetes in the future.
Yeah, let's go over those risk factors. What are some of those?
Obesity is a big one.
Yeah.
Family history is another big one. Usually obesity is the biggest one, but family history can play a role. There are some certain conditions. Sometimes you can get a virus that can actually cause diabetes. It'll actually kill the islet cells in the pancreas.
Really?
And so I've occasionally seen somebody that is a nice shape like you that will come in at your age and go, they're type 1 diabetic. Why would they magically be a type 1 diabetic at 35 or 32 years old? And you would assume there's some kind of, they got a viral illness or something that kind of caused them to attack their own pancreatic cells so they don't make insulin anymore.
Wow.
So that's a kind of a rarity, but you occasionally see that. But usually obesity is the biggest problem, especially with how young it's happening in kids. And there's 4 pediatricians in our office, and they'll have diabetics, and then they'll come see me at 20, 21 years old, already on medicine.
What are the symptoms?
So the symptoms that usually, the most common ones are polyuria, polydipsia, which means I'm really thirsty all the time, and I'm peeing all the time, because your body, if your sugar's too high in your bloodstream, your body wants to get rid of it.
Okay.
And your body's trying its hardest it can to get rid of it. So your brain has a response to drink as much water as I can, because my kidneys want to try to pee out as much sugar as I can. So people are really, really thirsty and peeing all the time, usually losing weight. You'll actually lose some weight before you see a doctor. The cool thing is we're seeing a lot of people come in now. They have to have wellness exams for their works, fill out this form. And so people that would not have come to see us in the future or previously will come see us every year because they want their
discount, right? Yeah,
right?
absolutely.
But you do a full lab panel and you'll catch some that are very early.
Okay.
So
you can kind of curb it a little bit,
correct.
right?
Yeah, I mean, you see somebody comes in healthy as a bug, and that their sugar's 140.
Okay.
Well, let's check it again. What's 140? Well, it's diabetic.
Yeah.
But it's early where we can maybe do some nutritional changes and do some medicine intervention, possibly do some weight loss, maybe get off medicine.
Eventually, right? Yeah.
And the main question I get from people is like, am I still a diabetic? You're diabetic forever.
Okay.
You can be diet and exercise controlled, but some people need to be on the opposite end or on insulin pumps.
Okay.
And so there's a varying range of that.
All right. Well, thanks for coming and explaining all this to us, Dr. Ballard.
One more thing. So Baptist Health, the Health Line, has multiple resources, diabetics, nutritionists, and resources to help people that need some education.
Okay. Call it on your screen. 1-888-BAPTIST is the number to call.